Arthroscopic hip surgery is the primary aspect of my practice. I do approximately 250 to 300 arthroscopic hip surgeries per year. My surgeries primarily involve labral preservation surgery, including labral repair and labral reconstruction, including FAI or femoral acetabular impingement correction. These surgeries are designed to improve pain, improve function, and return patients back to active lifestyles. Orthopedic surgeons that are performing arthroscopic hip preservation surgery have typically been using a traction bed or a traction device in order to pull distraction on the femoral head out of the acetabulum. And with the use of a post, any surgeon that is then transferring to a different system will be a little cognizant of change, and they would be a little reticent to jump immediately to a new technique. And the learning curve for my practice literally was one surgery. And with the use of the pink hip kit, it prevents the patient from sliding, and we can achieve distraction. After the hip is then out to distraction to an adequate length, which is approximately 10 to 12 millimeters, you can then perform your surgery, and there are no other changes to your technique that are required. And that is great because the cost of transitioning to a new bed or a new technique potentially is large. And with the use of our pad, you can keep your bed, you can keep the actual traction device without any significant changes to your routine and your practice. We've found that the actual preoperative positioning and manipulation of the hip is actually about 5 minutes faster with the use of a postless system. Our traction times are approximately similar, but our dynamic exam in the peripheral compartment, when we're correcting the impingement, it tends to be about 5 to 10 minutes faster because of the adequacy of our dynamic arthroscopic and fluoroscopic exam. There are several advantages of the technical aspects of performing hip arthroscopy with the pink hip kit. One of the biggest ones is the avoidance of the post. The post truly does get in the way. The post gets in the way of the fluoroscopic unit, does actually interfere with x-rays in some situations. But moreover, when you're doing what's called a dynamic hip exam, where you're assessing the adequacy of your impingement correction, when you want to take the hip through a range of motion, and with the post eliminated and using the pink hip kit, it can really permit you a full range of motion with flexion, extension, internal, external rotation, and abduction and adduction. It truly does give you a free degree of motion of the hip so that you can test the adequacy of both your dynamic arthroscopic exam and also your dynamic fluoroscopic exam. Truly making sure your impingement correction is perfect so that it will no longer cause any potential labral injury, articular cartilage injury, and hopefully reduce the risk of osteoarthritis at a long term. And one of the things that we have always tried to improve upon is the safety of the procedure. In addition to the efficacy, we want to make sure that we reduce the risk of any kind of complication around the time of a surgical procedure for our patients. One of the big complications associated with the first technique that we used with hip arthroscopy was the use of a perennial post, and that post has been associated with many different kinds of complications that's always prompted a look into potentially a safer way to perform the procedure. One of the complications that is significant that patients have read about or heard about is the potential numbness to the perineum, numbness to the genitalia, numbness to the inner thigh. And that is something that if patients don't bring up, I like to bring up, because if something like that would happen, that is a very big deal to the patient and to their family and to their physical therapy recovery after surgery. And the nice thing with our postless system is that it truly does prevent that complication. Hip arthroscopy typically takes about 1.5 to 2 hours to perform the labral repair and the impingement correction. When you use a post between the legs, what can happen is there's a large amount of pressure applied to the perineum, the genitalia, and the inner thigh. And that can be associated with skin injury and with nerve injury, and this can happen in some studies as high as 30 to 35%. And this is something that if you could eliminate that post, then you can actually reduce that complication to the perineum down to 0. So I've now performed hip arthroscopy on a few patients in which we've done one of their hips with a post and their other hip without the post. And the way that this originally came up was there was a patient in which we did her right side with the post 2 years ago, and then we had just done her left side approximately 3 months ago. And one of the first things that she told me when she came in for her initial post-operative appointment was that, "Did you do something different?" And she didn't even let me say, "Hi, how you doing?" Her question was, "What did you do different this time that you didn't do the time before?" And the first thing that I said was that we use this new system that's called a postless system, which we didn't use the post. And she said, "My pain was 0. I took 0 narcotic pain pills after surgery. I felt better. I had less pain on my thigh, less pain in my perineum, And this overall recovery for the first 2 weeks was dramatically better. And then after that patient encounter, the next 4 patients that I'd actually operated on, in which they'd had one side done with the post and one side done without the post, I asked them that question. And now this is certainly a small case series of 5 patients, but all of them have universally said that their overall early recovery was easier, with less pain. They were able to recover and get to therapy a little bit better, and there was a 0% incidence of any numbness or skin problems in their perineum, in their inner thigh. And so this is something that comparative single patient case study, in which we're looking at a post in one side and postless in the other side, has shown that there is less pain, better early recovery. And we really want to try to get patients off of pain medications and any kind of opioid dependency within the first 1 to 2 weeks. And that's something that if you can reduce that early pain by using the Pink Hip Kit, then that is one of the biggest advances that we have in our hip preservation techniques, because we can make our surgery safer and make our surgery better.